Time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, major news about heart disease. Two new studies in the New England Journal of Medicine say a single gene may be critical to lowering your heart attack risk. John, tell us about these studies.
Well, the gene is called ApoC3, and people who have mutations in that gene have much lower than normal levels of triglycerides, which are kind of fat. Now, there's been some controversy. People with high triglycerides seem to be at increased risk of heart attack, but it's been hard to show that lowering triglycerides lowers the risk of heart attack, as, say, for lowering LDL, bad cholesterol with statins. We know that lowers the risk of heart attack. Well, it turns out that these people who had a 40% lower level of triglycerides also had a 40% lower risk of heart attack. So that's really suggestive. It's not proof that lowering triglycerides might be something we could do to improve outcome.
But does this discovery actually mean that they could change how they manage heart disease?
That is the big question. So we've had the statins around for so long, and the question is, now these are people who have mutations, and we know that they happen to have lower risk of heart attack. What happens if we develop a drug, and one is in development, that lowers triglycerides significantly, and you give it to a lot of people over a number of years? Will that lower the risk of heart attack in them? And that remains to be seen.
So we think there are possibilities here. I mean, there hasn't been a new drug here in a long, long time, right?
There really hasn't. Of course, Americans love drugs. God forbid that we should actually do exercise and eat right. But, of course, we're all excited. Maybe another magic pill.
A new weapon in the battle against diabetes also made headlines this week. It's called a Bionic pancreas. The device works with a smartphone to check blood sugar continuously. Then it automatically triggers doses of medications. The Bionic pancreas helped adults and children with type 1 diabetes improve their blood sugar levels overall, with fewer cases of dangerously low blood sugar. Researchers hope similar devices could also help fight other diseases.
First Lady Michelle Obama met with medical and health reporters at the White House Wednesday to talk about enforcing federal requirements on school lunch nutrition. So, John, you were not only at this meeting, you were sitting right next to the First Lady.
Right. Well, she invited a small group of medical correspondents, and she came in with Dr. James Perrin, who's the president of the American Academy of Pediatrics, and Sam Cass, who's one of her senior nutrition advisors. And she started off by saying, look, a couple of years ago, we were all celebrating because there was legislation passed that improved nutrition standards in schools for the first time in like 30 years. And there was a 90% compliance rate with this. This was according to best evidence by the Institute of Medicine. And then in the last couple of years, there's been some pushback by school districts and others who are saying, look, this is too hard, it's too expensive. And this has led to, last month in the House Appropriations Committee, a bill was passed that said, look, if school districts are losing money on this, on the meal program for 6 months or more, they can opt out. And this has not become law yet, but this is causing the First Lady to be extremely concerned that this could lead to a rollback of the entire program.
Holly, this is such an obvious positive thing to do for kids.
Right.
Why do you think it's still so controversial?
You know, Anthony, money.
Yeah.
You know, really, I think school districts are concerned they're going to lose money on their school meal programs. They're fearful that kids won't buy the healthy lunches, or they'll just opt for things in vending machines that are unhealthy. But, you know, we also have to keep in mind half of all the calories kids consume happens in school. So it's not really something where we can opt out. We've got to figure out a way to make this work, you know, and it's surprising that the adults are doing the pushback as opposed to the kids.
Right.
But we've got to make it work.
Yeah, that's exactly what the First Lady said. She said she expected the kids to push back, where are my French fries and chicken nuggets, but she really was surprised that it's the grown-ups.
Finally this week, a Canadian woman credited a selfie for helping save her life. Stacey Jeppes says her face went numb back in April. She went to a Toronto emergency room where doctors said she was suffering from stress. 2 days later, the symptoms came back. This time, she hit record.
It's all tingly on the left side, on the left side. The doctor said to breathe in, breathe out, manage distress. And I'm trying. I don't know why this is happening to me.
Jeppes played that video for doctors, and they confirmed she was having a mini stroke.
That is
Talk about getting a great history from a patient, right? You've got it right there on video.
It's so remarkable. I'm having more and more patients send me pictures of rashes, of bruises, but I've never had anything as dramatic as that.
It's good she pulled over to take that video. Dr. John LaPook, Dr. Holly Phillips, thank you both.